So let's take a look at rotator cuff anatomy. For the rotator cuff, we've got a group of 4 muscles, and we can abbreviate these down into the SITS group. SITS, S-I-T-S, Supraspinatus, Infraspinatus, teres minor, and Subscapularis. So what do these muscles do? Well, the 3 posterior rotator cuff muscles come around to form a cuff on the superior aspect of the head of the humerus. So the 3 of those there together kind of wrap themselves around there, with the 4th one, Subscapularis, coming from the anterior or medial portion, and the 4 of those together form this kind of secure cuff. The shared action of all 4 is to stabilize the head of the humerus in the glenoid cavity. So it stabilizes the ball within the socket. So we obviously need these 4 muscles working in harmony, in unison, to provide equal length tension from one side to the other to give us a good position of the head of the humerus within the glenoid or the socket. Let's start with supraspinatus. SITS, S, supraspinatus. The name means that it's superior to the spine of the scapula. And that's the first bony prominence that we're going to look at as it refers to these first couple of muscles. So supraspinatus is at the top, inserts onto the head of the humerus, and as it contracts, it's going to abduct the arm. It's really only responsible for this first portion of abduction. After that, the lateral head of the deltoid takes over. We go inferior to the spine of the scapula, and we've got the infraspinatus, so inferior to the spine of the scapula. This muscle actually shares the same actions as teres minor, which sits just below it. These 2 come together onto the lateral side of the head of the humerus, and they laterally rotate the humerus. They also adduct the humerus, and they work together with supraspinatus to provide support and stability of the head of the humerus in the glenoid cavity. So we've got teres minor. Of course, you'd have teres major. We're not going to talk about that today because that is not a part of the rotator cuff group. However, it has almost exactly the opposite actions as teres minor. So underneath the scapula, if we could lift that up and see from the anterior aspect, we've got subscapularis. And as you might at this point be able to guess, if the muscles on the dorsal side of the scapula, the back of the scapula, laterally rotate, then the muscles on the ventral or anterior side of the scapula are going to medially rotate, and that's subscapularis. Try not to forget about this muscle because it's in there and it's big. It covers the whole ventral or anterior aspect of the scapula on the subscapular fossa, and it medially rotates the arm. So hopefully now you'll have an idea as to why we call them the rotator cuff and how these muscles all need to work in harmony with a good length tension relationship to maintain control of the head of the humerus within the socket.